Hello, I'm really sorry. We tried this live session and there was some problem with the network and we could not start. So now we are restarting this today's important live session where we will be taking questions about the repair hair transplant. And I can see that few of the esteemed people have already joined this live session, and I saw one of the questions being placed in our previous live session, which ended abruptly. So, Mr. Nandgopal, I acknowledge you being on this live session, and please write down in the question in the comment section below so that I can address it. This live session is about repair hair transplant. Repair hair transplant means that a transplant done in which there was already a hair transplant being done and now you're looking out to improve the results of the transplant. So first of all, friends, the most important thing is that every hair transplant, like any other medical procedure, has its own limitation, and these limitations are in the terms of density. And density of the transplanted area is almost 40 to 50% of the normal density of the donor side. Because if we try to put um, if we are trying to put many grafts in a small area, many of the grafts will not get vascularized. That means that there will be a lack of blood supply and they will die off. So there is a limit of around 50% of the normal density. Uh, these are the expectations. The life of these hairs depend on your donor hairs. A pre-operative assessment is very important before actually undergoing the first procedure, and you should always talk to the doctor about the long-term implications of these hair transplants, how much care you have to take, how much till how much time you have to take medicines. So one of the question I can see here is that Mr. Nand Gopal is saying, I have my hair transplant 1 year completed, my 50% ball drops, my continue use minoxidil 8 to ball drops. I'm not able to understand what this mean. But if you are asking about that you have your transplanted hairs have lost, they have fallen off, then probably you need to consult your clinic once. You are saying that you use minoxidil for 8 to 10 months. So minoxidil should be used at least for 1 year, twice a day. That's our protocol, and after that, as a maintenance sitting, you have to keep on using minoxidil, because minoxidil basically improves the blood flow to the transplanted hairs. And there have been a lot of studies now which show that the results of hair transplant are better if you are taking simple medicines like minoxidil, and this keeps the transplanted hairs healthy. And there are some clinics which claim that you don't need any medicines after hair transplant. So please don't fall into the trap. It's a well proven fact in various articles that results are always better if you are taking the medicines which the doctors prescribe. And the most important medicines about the after the hair transplant are minoxidil and finasteride. If you are having any side effects of minoxidil, or if it's not working out for you, then in that case, then we have a video here in the link above. We'll share that video with you, and you can watch that video to see how you can stop minoxidil. Another such video is about finasteride. But if there is no side effect, it not only keeps your transplanted hairs healthy, it also prevents the fall of the existing hairs, because many a times majority of the patients do have some thin hairs in the area of transplant. And if you keep them also healthy and the transplanted hairs also healthy, that will contribute a lot to the hair volume. And uh, yeah, just take your question. And you have taken PRP also, Mr. Nandgopal. So I think that is good that you are taking all these treatments which will support the growth of the transplanted hairs. PRP is good, and PRP is good, but please do not stop minoxidil and finasteride. We have a video about how do you lose. Sometimes people expect sudden fall of transplanted hairs around 8 to 9 months post transplant, and there are various reasons, 4 or 5 reasons, and we have a video on our YouTube channel about why you can suddenly lose the transplanted hairs around 8 to 9 months. There are various reasons to that, and if you please see if they one of the reason can I mean be attributed to the hair fall after your transplant. Next question is Mr. Ayan Khan. You are saying that beard hairs can be used to cover the depleted donor area in the backside. Yes, yes, yes. So this is possible, but even much better than using beard hairs to the depleted donor area. I mean that means that the donor area is over harvested. So donor area over harvesting can be, especially by FUE and also by FUT, can be easily treated by a procedure known as scalp micropigmentation. There are two ways to minimize the scalp show of the donor area. One is very simple method is to keep your hairs at least 2 to 2.5 centimeter long. If you keep your hairs trimmed very short hairs in the donor side after the transplant, then there is definitely that area from where we have taken out the grafts, the doctor has taken out the grafts, whichever clinic has done it for you. Then in that case, uh, your donor area will be visible if you keep your hair short. So very simple way is to take a haircut around 3 months post procedure, not before that, and keep your, I mean, once haircut once every 3 or 4 months. Trim your hairs from the side, but keep the backside hairs long to decrease the scalp. So very simple way. Second way, if after keeping your hairs longer or your hairs are very thin, then you can go for scalp micropigmentation. It generally takes 3 sittings or sometimes one more sitting, and by that your donor scalp visibility is decreased. And on our YouTube channel we have, I think, couple of videos about how we address the problem of donor side depletion due to over harvesting by scalp micropigmentation. So you can watch that, and there are other videos about scalp micropigmentation also if you want to know what it is. And there is a complete playlist of in very very informative videos about the scalp micropigmentation on our YouTube channel. So please do find that, and I think that will be good for you. And yeah, how to deal with anxiety in shedding phase when your scalp goes bald as before or more. So to know about this, if you know about this, that this is something which is going to happen, that is known as ugly duckling phase, and typically this is seen between 1 to 3 months post transplant. This is a very very normal phase, and anxiety is also very normal, but you have to understand that if you are anxious at this phase of life, what anxiety does, it releases a lot of cortisols are steroid hormones, and cortisol can lead to uh, this can lead to increased hair loss, and this is known as telogen effluvium. It is known that stress is a major contributor for hair loss, and if you are very anxious about your hair transplant and the results, then in general, in our last 19 years of hair transplant practice, we have seen people who are very, very anxious about the results. In that case, the results generally are poorer. But people who think that okay, they have undergone a procedure and then they are sort of carefree about it, just follow the instructions, they know, they're well informed what is going to happen, they are in touch with the clinic and all, then in those patients we have seen that the results are much better. uh, Take a healthy diet, please keep on taking the medicines which your clinic has advised to you, and in that case, if the stress is not more, then in that case the results are going to be better. And sir, मुझे depleted donor के लिए hair transplant करवाना है, is it possible? We have to analyze, I mean we can't give an answer based on this. uh, So unless we see your pictures, what are the possible scenarios where you underwent your hair transplant? What's your family history of your grade of baldness? So we have to repair hair transplant is very very challenging. This can be for the front, for the donor side, the recipient side, and every case has to be analyzed in a proper way before actually doing another sitting of the surgery. We had a patient like around a month back. This patient had already undergone two hair transplants from some other clinic, and there was very very poor growth. The moment we did a dermoscopy, we saw that there was some skin changes. So instead of going for another round of hair transplant, we did a biopsy and we found out that he was suffering from an alopecia areata, which is an autoimmune disorder which can destroy or transplanted hairs. And in those kind of cases, the treatment is medical rather than going for another sitting of hair transplant. So please do not jump and think that it's always successful. We have many videos which show that in every case it's not going to be successful. Patient selection is very very important. Even after doing good work, many times even the best of the clinics, it may not work out for you. You should have reasonable expectations, and you should know that it sometimes doesn't work out, especially if there are skin problems. And yeah, this is very important. We can't answer. Like, another question is, got a hair transplant done 2 years back, जो कि fall हो गया क्या? So yes, you can always go undergo a second hair transplant, provided the doctor has all seen, analyzed you, done a trichoscopy for you, has seen how much of the donor area left, what is the condition of the recipient area, and a lot of factors have to be analyzed. First is trichoscopy, where we see there are advanced softwares to analyze the donor site to see what's the remaining density after first hair transplant. Sometimes we have seen many cases very minimal growth in the front in the transplanted area, and the donor site is extremely harvested. बहुत ज़्यादा grafts निकाल लिया पीछे से और यहाँ पर poor growth है. In that case probably या तो hair graft बहुत अच्छे से हैंडल नहीं हुआ, या आपको स्किन की कोई there can be a problem of the skin in the transplant. In that cases we have to do a biopsy, and then only we have to undergo another sitting of hair transplant. Because uh, I think anxiety we have already discussed. हेयर ट्रांसप्लांट से डिप्लीटेड डोनर एरिया को कर सकते हैं आप. वी कैन डू, बट वी हैव टू सी. We can't give a specific single person question based on just this question. I mean, we have to know all the facts. Okay, you're coming on. Please come. You're most welcome to come. I have started losing the hairs in the crown region. What should I do to stop it? Crown region, actually, crown region is very different from the front and the mid scalp. You have to try medical treatment, and medical treatment has to be tried for at least 6 months to 1 year to see how much. Crown region generally responds very nicely to medical treatment, and you should contact a local doctor nearby who is ISHRS credential. There is a ISHRS physician directory available on the website www.ishrs.org. It is a worldwide directory of all the doctors who are ISHRS member, and it's an International Society of Hair Restoration Surgery. It has some stringent criterias for the membership, and I am also one of the member of the membership committee. So only people who are doing ethical practice are the members of ISHRS. There is a minimum standard to that, and it has a lot of good doctors in the top. All the top hair transplant doctors are generally member of ISHRS. So please contact one doctor nearby and then take medical treatment. And then if medical treatment is not working for you, then you can plan out a hair transplant after trying it for like 6 to 9 months or at least a year or so, not before that. So please do not go for a quick fix solution for the crown. Generally gives poorer result than the front hair transplant, and generally it's not very satisfying, the results, and generally may take more than one sitting. So please discuss all these things with the doctor in detail. Then, high is PRP necessary after the hair transplant with thin donor, or one can get decent with minoxidil finasteride or any? See, PRP is good. PRP is it's your blood only. Autologous tissue means your own blood is, and there are a lot of growth factors in that. So the best case scenario is to do PRP along with minoxidil and finasteride, but it's not mandatory. Many people, we have a lot of patients of ours who are like 15 years post procedure, and they did not undergo any PRPs, and still their results are very good. They're maintaining the results with just minoxidil and finasteride and biotin-based multivitamins. So it's not mandatory. If you can do it easily, then you can do it. But please do not be stressed about that you need a PRP to get the results. Only that is going to work. Nothing else is going to work. So it's not like that. Then another question is, minoxidil और finasteride के रेगुलर यूज से जैसे हेयर लॉस से पहली कंडीशन थी और रिवर्स कितना पॉसिबल करना पॉसिबल है? इट्स क्वाइट डिफिकल्ट. आई मीन इफ यू हैव लॉस्ट सिग्निफिकेंट नंबर ऑफ हेयर्स, देन पहले जैसा करना may not be possible. It again depends what's your current density in the recipient area, what's your current thickness of the what is the terminal to vellus ratio, and what's your coverage value. And medical treatment say if you are going to respond or not, as I have all just said, at least 6 months का trial देना ही चाहिए before actually undergoing a hair transplant, especially if you are just started losing. But if you have lost all your hairs, please never ever think that with the medical treatment your condition will become what it was like before. So it's very difficult to have the same kind of, because every successive hair cycle, which can last from two to 6 years, there will be some sort of permanent thinning of the hairs in the balding zone, and then in the next cycle further thinning, and then it will fall off completely. So it's quite difficult. So minoxidil, we have already discussed this. So I want to ask, will there be additional scarring from the repair procedure? Yeah. So scarring, whenever you see a clinic saying no scar, scarless technique, please run off from that clinic, because every clinic which says there is no scarring with FUE or FUT, they are not being ethical with you. Even FUE will have some micro dot scars everywhere. Dot scars will be there, and with FUT there will be a linear scar. Even primary hair transplant will lead to scarring, especially in the donor area. In the recipient area or the bald area, if you are undergoing a hair transplant, the chances of scarring are very, very minimal, because the blades which are used to make the slits or site creation, they are very fine. They generally do not leave a scarring in this area where the transplant is done. But in donor area, there is always going to be some scarring. Minimum, or how much it is, depends on the size of the punch, especially in FUE. So there will be some scarring in the donor side, but not in the recipient side, especially if there has been no previous scars. Sir, DST hair loss possible or regrowth? I am not able to understand what it means. DST hair loss possible or regrowth? PRP treatment से कितने दिन में result दिखता है? अकेला PRP treatment only will not give you very good results. I mean, you need to take medical treatment. We have a video about how effective is PRP. PRP alone is not going to solve all your problems. You need to take medical treatment. कितना result दिखता है depends on person to person. Same thing cannot apply for the different grades of baldness. Itching 6 to 7 weeks in recipient area, does it indicate any failure or is just normal? Itching is very, very normal. But just see if that itching is happening just after applying minoxidil. Sometimes minoxidil can lead to some itching, because minoxidil का जो delivery agent या preservative है, that is propylene glycol, which is alcohol, and sometimes alcohol can lead to this itching. In fact, the most common side effect of minoxidil is itching, redness, small pimple formation. In that case, uh, you need to stop minoxidil for a week or 10 days and see if your itching has decreased or not. If your itching has decreased, that means the itching was because of minoxidil. But sometimes there is some normal itching also which is happening, especially after the hair transplant. So I think that covers some of the points. If there are some other questions, I can take it, because we have just few minutes left. The only thing I would like to say is, when you're going for your first procedure, please choose your clinic very wisely. Do not go for unlimited number of grafts at the minimum cost. We had a patient here, they came and they said that somebody was giving them very, very low price unlimited grafts. So there is nothing like unlimited graft. Probably what is happening, they are taking out a lot of grafts. Some of them will grow, some of them will not. So you're choosing the doctor from where you're getting a hair transplant done is very, very important. Always choose the first hair transplant doctor who at least tells you that there is a limitation. Any doctor, we have a video about 7 biggest lies the hair clinic tell you, and I think the link is here in this chat box itself. So uh, uh, if you find any of these things being said by the clinic, please be very very cautious. uh, See, this is a very, very good question, Mr. RZ. These days, AI chat GPT does answer many questions related to surgeries. People are using it to gain information, then going to the consultation. See, I think both the things are complementary. Both the things are complementary. That chat GPT information should complement the doctor, because ultimately you have to go to a doctor to get the prescription, you have to go to the doctor to get the hair transplant done. It is very good to have basic information about hair transplant from chat GPT, but please remember that no two people are absolutely same. Sometimes people come and say my friend got a hair transplant done and I want to get results like him, so that's not possible. You have to be analyzed uh, individually to see what are the donor hair characteristic in trichoscopy for you. That is something which nothing can do. I mean, you need a personalized analysis or consultation to see your donor side, what kind of skin you have here, and there are a lot of devices and softwares to do that. This is something, but it's good to have a basic knowledge, because that will give you at least an idea about what is actually hair transplant or hair loss treatment. But you will not be able to take medical treatment or hair transplant just based on that. Consultation has to complement basic information. You can get from many many sources, there's no problem with that. Then if I have a blood phobia, sometimes I feel during blood test, will this create issue during my hair transplant? I have fear of pain as well. So we do get a lot of patients who have blood phobia and fear of pain. We had a patient like couple of weeks back, extremely sensitive. Even if we were touching him before the procedure, he was shouting and all that. So there is a way we manage this anxiety of the hair transplant. We give some anti-anxiety medicines and all. Very, see, the pain in hair transplant is only for 10 minutes when we are giving the anesthesia. Once the anesthesia part is over, you don't get any pain at all. So then after that local anesthesia agents are mixture of short acting and long acting compounds. So the immediate effect is immediate and lasts for 7-8 hours. So you don't need repeated injections. And the needle by which we are giving this local anesthesia is very very fine. It's an insulin syringe. We give some vibration devices also are used to minimize that pain sensation as well. Blood phobia, you won't be able to see the blood, because mostly because the light is quite it's very, I mean, bright na. So we sometimes give, if you need, you can wear this thing, eye cover, to not to see the blood. So blood phobia is not an issue. Pain phobia, everybody has pain phobia. You have a fear of pain, everybody has a fear of needles. Nobody wants to get a needle unnecessarily. You have to weigh the risk, I mean, of that phobia, which is very I mean, very natural, and how much you want the new hairs. If you want too many, I mean, if you want hairs out of hair transplant, you have to bear some pain. As they say, no pain no gain. And we done 3 hair transplant, should do SMP to cover other ways. Ricky Mojaria, you're saying that how many PRP sessions? So we don't suggest any. It's an ongoing treatment. PRP is a maintenance treatment. It's not a fixed number of sittings which are going to make difference. And if after 3 sittings should you stop, you should not stop taking medical treatment, as we have discussed in this video initially. Yeah, so medicines are going to make your hairs healthy. SMP in the area not done. No, 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 not at all. SMP can only camouflage the area where there is some hairs actually present. If there are some hairs, at least some minimum hair volume is there, then you can do SMP in that area, but not in a completely bald area, because those dots of the scalp micropigmentation will be quite visible. That's my take on this. And there are a lot of other questions also, and we have a lot of videos about repair hair transplant on our channel as well, and we will keep on making such videos more and more. And I think we have to stop this session because we are out of time now. Yeah, so last question, you have multiple consultations but never get, you always should take 5 6 7 consultation and then go with your gut feeling. We have a video about how to choose a clinic, 3 days for 4K grafts. So yeah, it depends on clinic and their expertise, it can always vary. Same thing is not going to be, even the doctors have different level of experiences. We do 4,000 in one day, but it doesn't mean everybody can do it. And you should take it from multiple, and then wherever you feel that the answers are given in a much more ethical and honest way, then only you should take procedure. Do you suggest? No, I mean, we have to. We give suggestions based on the individual case. I think we have to now stop the live session because already over time. Thank you everybody, and you can always reach out to us. Thank you.